I call the Honourable Member for Werriwa.
Thank you, Deputy Chair. I rise also to make my contribution to the Mental Health and Suicide Prevention Select Committee's final report. The committee was tasked with providing recommendations based on a number of reports that have been released over the last 3 years and provide a roadmap for improvements to reduce suicide and the suffering that ill health causes our community. As we've all experienced in the last 2 years, Australia has been presented with many events, both here and overseas, that have challenged our normal way of life and caused stresses to many. The horrific fires of 2019 touched all Australians, with many losing their homes and livelihoods. And just as people were getting back on their feet, many states in Australia were flooded. But since 2020, we have all endured the COVID-19 outbreak. COVID, through necessity to keep us safe, has taken away what humans really crave the most, the support of family and friends. This was, of course, for the best of reasons, but it has increased the incredible stress for many Australians and the mental health system that supports them. Extended lockdowns have meant families and people have been touched by isolation. They've missed significant events with their families and friends, exacerbating the fear of the unknown, and that has affected every corner of the earth. The 2020 Productivity Report, the Royal Commission into Victoria's mental health system and various other investigations into Australia's mental health provisions have highlighted that the system is suffering from affordable access for all Australians who need support for their mental health. Issues with your mental health can affect every part of your life, relationships and physical health. It can affect a person's capacity to care for themselves and others and hinder a person's capability of participating in social and family events. Approximately 1 in 5 Australians and nearly half of all adults will experience some sort of mental or behavioural condition in their lifetime. It can be episodic, acute or chronic. It is clear from the evidence the committee heard that early intervention and proper evidence-based support is what can make a difference in people's lives and ensure they are able to improve their mental health as soon as possible. The committee heard that although advances have been made in many conditions and misunderstanding and stigmatisation is still a problem for many people. This stigma leads to deferred action and can lengthen the time that someone is unwell. The final report released by this committee proposes evidence-based recommendations that will steer our approach to mental health in the right direction. It shows there is a need for a big-picture approach to mental health in Australia to account for long-term effects of the pandemic. I see it in my community, where rates of mental health are skyrocketing without appropriate services to deal with them. Amplifying Voices during COVID-19 report, recently released by the Western Sydney Migrant Resource Centre, found the impact on mental health was the biggest issue across diverse backgrounds. There is also a feeling among diverse communities across the country. This is why the committee has recommended that Commonwealth Fund training resources for mental health workforce that can provide culturally appropriate and sensitive services to both Aboriginal and Torres Strait Islander people, but other called communities and gender-diverse individuals. Time and again during the hearings, we were told about the lack of appropriate services to support those who were struggling. Teenagers are waiting months for support in a time of unprecedented stress. For 2 consecutive years, Year 12 came in and out of online learning with a HSC around the corner. This is an exam in the best of circumstances that can cause extreme stress for its participants. We also heard in successive hearing about the severe lack of services in regional and remote areas. There needs to be a decisive and comprehensive action to address issues in this sector. Professor Ian Hickie said the mental health system should provide the right care first time. He believes that governments need to model in advance what the outcomes of our system should be, who needs to be involved in the service delivery and how best that can be achieved moving forward. Professor Hickie put to the committee that modelling has shown that if all these things are agreed upon around Australia, we could spend approximately $14 billion a year on mental health. If we don't make these decisions and continue a business-as-usual approach, we will see Australians spending $22 billion a year in a system that is still not functioning efficiently. All the evidence the committee heard pointed to workforce shortages and overwork of those professionals in the system. At times in some communities, especially in our outer suburbs and regional and remote areas, there are long waiting lists. Improvement in mental health are best achieved with timely support and appropriate medical assessment and interventions by, in many cases, multidisciplinary teams. We need more psychologists in schools, better access to see professionals, affordable services, and expansion of digital services, funding for regional and remote services, and for culturally appropriate support for CALD and First Nations citizens. The committee has recommended the Commonwealth investment to determine the long-term impacts of trauma and how it is compounding with successive natural disasters. But any decisions that are made require data to ensure plans are made properly and limited resources are used efficiently to make a difference. The committee also recommends that accessibility be at the forefront of all policy making. This recommendation, along with the investment to determine the long-term impact, will go far in identifying mental health in Australia. Identifying the causes and being aware of these causes is a fundamental step in the process of mental health and suicide prevention. The inclusion of the National Mental Health Workforce Strategy within the Department of Health and the National Mental Health Workforce Strategy Task Force is one recommendation which will be a positive blanket effect on mental health and suicide prevention. This strategy involves a national standardisation of suicide prevention training for all health and allied health professionals. The committee recommends more work be done in schools to combat mental health. This includes an independent evaluation of the effectiveness of all existing programs supporting the wellbeing of students in schools. Increasing the number of psychologists in schools will make a huge impact on the outcome of these programs. Also, training teachers with wellbeing and mental health support is essential for a positive outcome. Teachers need to be prepared to respond appropriately if a student reaches out for help. And throughout the hearings, we also heard about the importance of IT-coordinated care. Professor Hickey also urged that receiving the right care at the first time is crucial. He argued with no widespread adoption of smart healthcare technologies, this could easily be developed to support a wide range of organisations. Australia is a leader in mental health care innovation, but we lack the fundamental IT backing that can improve support across the sector. NBN and access to telehealth is a problem throughout Australia, but particularly in regional areas where there are also a lack of face-to-face medical specialists in the community. Professor Hickey talked about the urgent need for support in regional and remote areas. He believes the system as it stands is not structured for the benefit of regional areas and non-government organisations are doing little to help. Professor Hickey also advocated for regionalisation, which means a cooperation between federally funded primary health networks, state-run services and the non-government sector, as well as a strong active action from private health to address the gaps in services. I would like now to thank everyone who took the time to make submissions and who so generously provided their expertise in hearings over the last 9 months. Your insights and assistance with our questions is very much appreciated, and I hope you can see your particular information in our report. I would also like to thank the Secretariat for their practical support during this inquiry. I appreciate so much their organisation of online forums, which for much of the time they were also working remotely. I would like to thank my fellow committee members for the collegiate and bipartisan approach to this committee, especially the member for Macquarie, the Deputy Chair, the member for Dobell, and the Chair, Dr Fiona Martin, member for Reid. I'm truly grateful to all of you for assisting me to understand this area of policy formation. I commend the recommendations of the report to the House.